Hello, Charlotte. Thank you so much for accepting this invitation and to participate in the second season of Prevtalks. It's a pleasure to have you with you, and also the team is very relevant. We haven't discussed it so far within our conversations with, experts and researchers and technicians and managers, but it's very critical as an intervention. So we're going to discuss cognitive behavioral therapy and how we can use it and with a focus specific on occupational management, stress management. So before we start diving into the questions and our conversation, could you present a little bit yourself? Give a brief description of what you're doing, what you're researching, who are you for our community?
Yes, thank you for having me here. It's a great opportunity to try to talk about this important topic in a different forum that I'm used to. My name is Charlotte, and I'm a PhD student from University of Southern Denmark, and I work in the research unit for physical activity and health in working life. I have a background in sports science and health and in psychology. And I'm mainly working in the area of work life. And yeah, I really enjoy working with mental health issues because they are just as important as the physical part, in my opinion. And it's all part of, investigating the healthy work life. I've mainly been working with musculoskeletal health issues in the workplace. And now I'm moving slightly into the more mental side of it. Yeah.
So in the end, everything is like, in the end, everything is related. We just separate the health and physical health. There's, just an holistic perspective that we still need to grasp in our practice and in our research. So first questions, and can you give like a brief overview of what is cognitive behavioral therapy, usually known as CBT, and how it can be actually applied to manage workplace stress?
Yes, well, cognitive behavioral therapy is a psychological intervention. It's a psychotherapy, and it's based on conversation. So what you do is that you have a clinical psychologist. You need a special training as a psychologist to be able to perform cognitive behavioral therapy. And it's the most widely used strategy towards stress. It's also often used for depression and anxiety, and it's well researched and well documented to have an effect on these kinds of problems. And it's a little tricky with stress because stress is not a diagnosis. It's more like a condition, and the way we define it varies greatly across different fields. Some call it burnout, and it's a little different from what we use here in Denmark. It's often called adjustment disorder. And when we talk about stress in work life, that means that the stress must have occurred because of some issue or problems related to the working life, and that's often a high workload or problems with management, not like bullying, but it's like those when a manager, for example, puts a lot of pressure on the employee, that could be a factor that could lead to stress.
It's interesting as you describe it as an adjustment process, because actually stress is not inherently negative. So it means that if you have the right skills, internal or in the team or in the in the leadership, you'll be able to completely adjust to all the demands that you might have at the workplace. But the reality is a bit different. People do struggle with this adjustment and lack this support, skills, and competences. And within CBT, are there specific strategies or interventions that also research is saying? As you said, it's very interesting because although CBT is also considered a psychotherapy approach, it's very well researched. So it's not something yet to prove, right?
Yeah.
But do you find that within CBT framework, there are specific strategies and interventions that could actually help people with this adjustment process and reduce their stress at work and the work life? Because stress could also be, related to other issues in life, not just work.
Yes, exactly. And it's a very good point, because we need to stress that stress is not bad. It's bad if you're stressed in a long time. So it's actually a natural adaptation to a high workload for example, if you're a student and you have an exam or you have a peak workload, and then it's actually then you couldn't perform well if you weren't stressed. But if the peak performance is needed every single day, or if you perceive that you need to do 100% every single day, then you have a problem, because then the physiological and the psychological and social problems occur. And maybe you stop taking your breaks and go, you start working in the weekends and stuff like that. And then you can't sleep, and then it just, keeps going. And of course that affects your personal life. So stress is very hard to narrow down. And that's why it's difficult to say that CBT works equally well for everyone, because I think we need to acknowledge that employees are different, and some benefit in one way from this type of treatment, and some maybe they don't get as much out of it as we would like. And that's actually what I'm trying to dig into in my research. But we know that for some people, at least, and for many people, CBT works. And the way it works is that it sort of it targets both your internal thoughts. If you, for example, if you feel as an employee that you need to do 100% every single day, and you find it hard to say no to extra work tasks because you think that would make you a bad employee, then the CBT would actually challenge those beliefs and help you maybe find different ways of interpreting that situation. Maybe you should say no sometimes. That doesn't make you a bad employee. Those are the kinds of topics that you would work with in CBT. But it could also be targeted at your behavior, because sometimes if you struggle at work, you start behaving in a certain way. Maybe you perceive your colleagues in a more negative way than is actually necessary. And maybe that would feed back negative behavior from others. So in that way, you also work with trying to improve your communication, for example, at the workplace. So CBT is identifying your thoughts and feelings and behavior and trying to come up with alternatives so that you have a bigger repertoire of possible ways of coping with tricky situations. And of course, sometimes your work environment is just bad. Sometimes you're in a position where the employer is putting too much pressure on you, and that's not your problem. So CBT, at least the CBT treatment that I'm investigating, the aim is not to get people to comply with whatever. Sometimes it's making people see that maybe that environment is not good for you. So it's also saying no and saying maybe you should find another place to work if it's really bad. But I think in most cases, it's about helping the individual to come out of those tricky situations, and then helping the managers and those who are in the workplace to help you actually as an employee to work better in the environment that you are part of.
Sure. One interesting thing that you're stating about CBT that I find it's very different from other approaches is that recognition of it's not the individual that has to do it everything. So it's also very focused, what are the resources that I have, the limitations that I have. I can actually change my beliefs, and CBT can help me with that. I can change my perception, I can change my behavior, and this of course will help me manage my emotions, because I'm actually working on my internal patterns. But at the same time, is it also looking at the situation and acknowledging what is not working. And sometimes I am contributing to that, and sometimes I'm not. And so it's also interesting to separate, because sometimes in other approaches, such as coaching, it seems that the individual has the power to change everything, and it's not true. And so I think within the CBT model, it's very important to really also help the person to really analyze the context, and not be just, narrow in their own perspective, but also to broaden up and to participate in a different way, because actually the behavior could change. I could say what I need, I could say no, I could ask for more resources, I could actually be a little bit more proactive in asking for this resource. But this is a very big paradigm, because mostly in professional practice, most organizations think this is an individual issue. It means that you are not okay. So it means that you actually are the problem, and then they offer you therapy. But what you're saying is that therapy is just a tool. It's not the solution for workplace stress. And this brings me to our next question, that what are you finding? Because in your work, in your research, you're working with patients that actually are on a sick leave or have been in some situation relating to stress, and you are helping them return to work. What are the common challenges and obstacles that you find in this piece about returning to work after a chronic stress situation or even burnout in some cases? And how can actually CBT be a tool to help them overcome?
Yes. Well, I'm in the middle of the research, so I have only worked with a hypothesis about what helps them, and I've been that's what I'm going to test in a later stage. So I can't really say that I have a lot of evidence yet of that part of it, but I have talked to the psychologists who are working with this every day. So I have some examples of what I think, from an evidence-based background, what might work here. And if I start by zooming out to the big picture, to the literature, we see that CBT has been shown to improve psychological symptoms. So when you look at the scores, when you test them for their stress symptoms, you see that they are lowering their stress symptoms after having the CBT. So it seems to work, at least for a big part of the patients. But when we look at the association between having CBT and then returning to work, it's more muddy. We don't see as clear a picture. So something is going on in the process of getting back to work. And that's what I'm particularly interested in, because as you say, stress is more complex. It's not just the one person. It's about the work environment as well, and how the interaction is going on between the individual and the work environment that they are returning to. So if you're just returning to your workplace with the same problematic manager, then it can be difficult. And I know from the return to work literature that it's often very difficult, because it's acknowledged that stress is your problem. And then maybe if you're on sick leave from your job, they would hire someone to do your job for a period, and then you return from day one to full-time work. And having stress is not now I'm back to work, now I'm healthy again. It's when you have a stress reaction, it's because you have been experiencing pressure for a long time. So naturally, you should return to work gradually, feeling how is this going, and then So it
And
doesn't
some
just disappear.
Yeah, some adaptations, and you were saying sometimes it's the leadership support, but sometimes it's also the team. It's the other elements of the team that are not supportive of this return to work. So it's a several layers issues. There's a very interesting model researched in, I think it is from a Danish research group. I can't remember the name, but it's the Igloo model. I think you've heard about it. So it's actually a lot of levels of resources need to be activated within the individual, within the team, within the leaders, and also the organizational itself. And how can the organizational shape? And that brings us to the question that actually when you're not working, you're not experiencing the same challenges. So it's interesting that the research is so clear that CBT can help people that are at work while managing their demands and while managing stress. But when you're not working, you don't train those skills, right? Because you're not experiencing the same levels of demands in your daily life. So it's not the same situation. It's actually something that could actually not help you regain the habits of work and get back to your own way of dealing with the work challenges. But it's a very, and in our practice at Bound, we are working with clients, and it's a very, very, very sensible situation, because we see that traditional solutions such as EAP, employee assistance, or any kind of individual counseling solutions, if they are not specifically tailored for the return to work, they tend to not have any kind of positive impact, because actually the individual might not even be interested in using it, because he's just trying to focus on how can I actually make this work. But then there are not a lot of resources within the team, right? So there's no adaptations to the workload, there's no adaptation to the support, or there might not be changes in their role, because sometimes you need to come back, but not exactly to the same position or job description. But how in your research and what you're looking at it, how can actually companies use CBT or have success in using these type of programs when they want to reduce occupational stress and also reduce the possibility of occupational stress to repeat itself? So actually, after people have one episode, how can CBT actually work and be implemented within this context?
Well, I think CBT is more like a personalized therapy. So it's for people who need to gain more insight into their own way of dealing with this. But that said, they can feed back to the environment. And I think one of the key messages here is that employers and employees need to talk to each other. And so I think if I was working what's it called, a specialist or a psychologist in a workplace, I think one of the first places that I would start would be to try to have a way of communicating about the mental health in the workplace. Because if you want to design a better work environment where people don't get sick, you need to understand what are your employees and what are they equipped with. So how do you find that balance between the demands that you have as a company and what are your employees? And you need to balance those, and you need to listen to each other to be able to design the right work environment. Because we know that some people, they thrive with a lot of control over their work life. And that's very good. But if you then have employees who find it difficult to have a lot of control, there are actually people who thrive better in an environment where they are certain that the manager has the control and they are very good at doing what they are told. It sounds a bit, I don't want to sound prejudiced or anything, but we also know it from patients. Some patients like it when the when the doctor tells them, you're safe here with me, and I'm going to tell you how your treatment is, they feel comfortable. And if they are asked, well, what do you think we should do for your treatment? Then they become uncomfortable. So what I'm trying to say is that you need to identify what are your employees, what are their preferred work demands. And then you can adjust and say, maybe we should, our work demands should match whatever our employees, what their skills are, what their preferences are. Because often when you look at workplaces, you see that people just start making initiatives, but it's not what the employees actually ask for. So communication really, in my opinion, it really is key to design the best strategies. And you can't say there's one strategy that's universal. So it's this tailored perspective that I think we need to acknowledge, that employees are different and groups of employees are different, and we need to take a step back and look at what are we actually trying to do here. It's interesting that the patients that I'm looking at often comes from they are often from the public sector, and they often come in periods where there's a lot of changes going on. For example, a new IT system or new political regulations that are implemented that sort of disturbs the normal practices at work. So you should be very careful, I think, when you're trying to change a culture or a way of working by just a new IT system can actually be a huge extra work task for people to deal with. And that might affect you and your colleagues. And so be extra careful, I think, in those situations.
I think, you know, it's not to really impose CBT to everyone, because it will not work this way, but make it available if the person is motivated to do any kind of individual process and change that could actually lead them to have better skills. One aspect that you shared, and I think it's interesting, is that we tend to assume that the needs are the same, right? But each individual, each team, each context, and each organizational, or even I would say, not just the organizational context, but also our society context, actually puts a lot of people that normally could handle stress very well, but they feel less supported, or they have a more insecure environment altogether, that leads to even not be able to cope as we used to cope before. So even ourselves, even if we have the skills or if we are ready for it, it means that we have to look at the bigger picture and then to adapt the solutions to each particular context, but have them. And I think CBT as an intervention is quite solid, but it's still seen as therapy, right? So, for instance, in our culture in Portugal, we still have a lot of issues with going into therapy. So we are not as open to psychological interventions. We are getting better. Because also this process, and the last 3 years were really critical in terms of mental health, and Portugal is never a positive case. But I think, you know, we need also to recognize there are still some stigma associated with going into therapy, even if this therapy is as practical as short term also, because CBT is also not a long-term therapy as in other psychotherapies, and you could actually have huge results with a few sessions. So it's something very, sometimes it's like, but why are not people using it more? Because it's actually a very sound model. But it's true that perhaps there are individuals that cannot actually adjust so well to this intervention technique. But within the occupational setting, it's actually one of the approaches that companies actually like it the most, because it's very focused. We can tangibly show the results, right, in terms of psychological symptoms, but not just that, also in the satisfaction of the individual and their capacity to translate any kind of learning or improvement into their daily work life. but it's still a working process, and it's not for everyone, and it's not for every organizational setting, and we need to, of course, address the cultural issues and also some kind of stigma that could be associated. But it's a wonderful intervention for sure, and with a lot of future, particularly in the return to work. I think there could be developments, and you are researching about it. How can actually CBT could be applied, and how to make this intervention more sound, and perhaps not just focusing on the individual, but make it more sound in occupational stress. Okay, just one final question, Charlotte, before we end this lovely conversation about cognitive behavioral therapy. How do you see yourself working in 2030? What will you be doing? Would you be still, researching and working in academia? What are your plans? How do you see yourself working?
Oh, well, academia is definitely a hard place to be, because of, I think, all across Europe, it's hard to get funded. But I really like being able to ask questions and then having the time to dig into the nuances. So I hope I am in academia, but I don't know. But I think there's still a lot of work to be done here, because we know so much about CBT, and actually we know that it works. We also know that for some it doesn't work, but we don't really know why does it work. All the different pathways of getting better, having a stress reaction, or how can we. I'm looking at those who are who has been on sick leave right now because they are so bad. They're not in the phase where you can talk about it and make adjustments. They have hit the bottom, you can say. But there's a lot to be done preventively in the workplace, and I think that's when it gets very interesting, because that's a field that we should that I hope will be in more focus, because I think you can actually use a lot of the principles behind CBT to have those conversations and talk with your employees, or giving them a voice, because if you don't communicate, you can't make adjustments. And as you said, stress is not something that is isolated a person's problem, and it's not just for people who are mentally weak, or that's a myth. It really hits everyone, and especially it hits people who are very used to a lot of workload. So it's not for those who are who are weak in any way. That's a really misunderstanding, if that's still out there. I think in Denmark, stress is really recognized as a public problem, and you see each
and
year.
it's also related to many physical diseases and
Yes.
shorter lifespan, and any kind of chronic diseases. There are some already, relations to the experience of stress continuously in your daily life. And so it's something that, as you say, I think it's a field of research that really, really need to continue researching a lot about it, because it has impact in many, many other conditions, not just mental conditions, but also a lot of physical conditions, and a lot of somatic disorders also very associated with the experience of stress, not just at work.
And you see, like in the muscular skeletal research, you saw back in the days that having a workplace with a lot of dangers for your physical health, now it's very regulated, and you can't lift too much and all that stuff. And I think that's something we need to work towards in the psychological departments as well, because when the work is more and more cognitively based, we are sitting in front of our computers or in front of patients and people, then you can't just regulate. You can't say you have to use that tool to avoid the pressure. You need to work with yourself and have some, maybe we should train ourselves mentally to be a little more robust in the type of work that we have. And that could be just, putting a little sign of our emails saying, I'm not answering emails after 4 or whatever that is. But because the dangers of today's work lives are more invisible than it's easy to see if you have a heavy chair to lift, or a patient that is very heavy, that you shouldn't do that alone. You should have a tool. That's what we need to do mentally, I think, as well.
Yes. You also have other resources and techniques and support, and also, this rethinking of, also I think the rethinking of organizational designs and work design, but these are the kind of conversations that we need to have when we focus on prevention, because otherwise, you will just be intervening already when there are signs of stress and negative stress, not the positive one, but already negative stress symptoms. So thank you so much, Charlotte, and we wish you, lots of luck. And I know it's hard work involved. It's not just luck, but a lot of luck also for your thesis, and also, of course, for your career as a researcher. And at Bound, we are always, craving, the ones that produce the knowledge, because we can help the customers and we can help the companies and use this knowledge in a concrete way. And we need, of course, researchers and academia to produce the knowledge. Otherwise, it would be very hard for a consultant to do it by himself. So thank you so much. And I think it was a very, very interesting conversation about CBT, which is not so common to talk when we talk about stress at work and prevention. But thank you so much. It was very, very interesting.
Thank you for having me.
See you soon.